In the past, orthopedic surgeons thought that an athlete can dislocate his or her shoulder, put it in a brace or sling, rehab the shoulder, and it would do fine. We now know a large percentage of those athletes will have recurrent instability and end up needing surgery. Is there a number of dislocations that suggest it's time for surgery? My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on this channel. Now, also, before I ask the question, please know this is not, and none of my videos are, medical advice. This is meant for general information and educational purposes only. Here's the question. I'm a 16-year-old athlete. I dislocated my shoulder 6 months ago. I recovered, got back to play, but 3 days ago I dislocated it again. My doctor says if I do it again, he'll have to perform surgery. What do you think? All right, I don't know, quite honestly, that there's a specific number of dislocations that suggests it's time to surgery. Typically, the younger you are, and studies show 18 and under especially, but even as young as maybe 21 or 25 years old and younger, the chance of a second and third dislocation, what we call recurrent instability, is significantly high, 60%, 80%, numbers like that. And so as athletes are younger, typically orthopedic sports medicine specialists are more aggressive about fixing those primarily, repairing those, tightening the capsule, reattaching the labrum with stitches and anchors done arthroscopically. And I think you can make a good case for an athlete even after a first dislocation, but certainly maybe a second one at that young age, you would go ahead and do it. The risk of that ball sliding out of the socket is you could do more damage to the shoulder, damage the articular cartilage further, damage the bone, things that lead to long-term issues. And so we've gotten much more aggressive. Again, it's not an absolute number, but that's sort of the thought process that we typically think through. Now, if you have an orthopedic injury and you want to talk about options other than surgery, other than cortisone shots, I'd love to potentially talk to you. In the description below this video, you'll see a link to my contact page. Fill that out, and you can learn more about potentially scheduling an appointment with me. I'd also love to hear your experience with your injury. Leave those in the comments below. Just understand, if you leave a question in the comments, I can't offer you medical advice there, but I might answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video, and when I start my live streams, my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.